groups that have been identified as high-risk groups for possibly committing suicide obviously would be people that have mental health issues, depression or other mood disorders, possibly psychosis, which might lead to voices telling them to hurt themselves or kill themselves. But it goes deeper, much deeper than that. People with a trauma history, possible post-traumatic stress, veterans, kids that have been bullied, the lesbian, gay, bisexual, transgender community, people that have a family history of suicide, people that have actually attempted suicide in the past are certainly at greater risk. So the key warning signs to look for in somebody who might be suicidal would be increased talk about wanting to be dead, wishing that they would go to sleep and never wake up again, feeling like they have no purpose, expressing that they feel hopeless, expressing that they're feeling trapped or that they're a burden to their family or other people. Sometimes when we finally realize that a person may be suicidal in those last few hours or days before they might be more apt to make a suicide attempt, sometimes that can be a little bit too late, but it doesn't mean we shouldn't try. We have crisis numbers. Those lines are both staffed by professional counselors. I think some people still get concerned about talking with a loved one about suicide or killing themselves. And certainly it's not necessarily the most comfortable subject to talk about. So Central Maine Mental Health Services is basically a short-term consult service, if you will, to the primary care providers within Central Maine Medical Group. People often come in and tell me their story in the office and just assume that because I am a health professional and a mental health professional at that I can't possibly understand how they feel, that I've never been through that. So I think it's important for people to know that I have in fact been through it. I lived through it. Certainly if you understand where a person's coming from, it's a lot easier to be able to help them.